Well, hello again, everybody. Welcome into another Keep Boone Healthy Facebook informational video. We are coming to you again with two of our more repeat offenders of this platform, Dr. Scott Elliott, Superintendent of Watauga County Schools, Jennifer Greene, Director of Public Health for AppHealthCare. They are on here nearly weekly because of the kind of information that we're trying to share with you through this platform, and that being very heavily weighted toward community operations. And part of that comes to the forefront this week with new information coming out from Governor Roy Cooper and Secretary Mandy Cohen about vaccination plans for Group 3. We heard dates, we heard about priority groups, and we oftentimes try to bring that back in this platform into a Watauga County context. And that's what we hope to be able to do for you today. So to have these two experts on with us will help us make a little bit of sense of what that information is and how we can manage our expectations moving forward. So first of all, we'll start with you, Jen. If you can just kind of spell out what that information was about Group 3, what those dates look like, and ultimately, parse the words of the governor. What was said yesterday?
Sure. So we know we've been watching our groups because everyone is interested in a vaccine and we want, as many people that want a vaccine to get it. And right now we're in a group that are 65 and older and healthcare workers. So what we heard yesterday from Governor Cooper is that they want to move to Group 3 with a prioritized group within a group. For specific to pre-K to 12 in public, charter, and private schools and childcare staff. And so we know that this is an important transition for us to consider because we still have, quite a few people who are still waiting for a vaccine. The other part of the announcement was that they're going to move to broader Group 3. And we still have, more details to learn about that, but that would come 2 weeks later on March the 10th. So I think there's still a lot to learn, but the big news being that, educators in the K-12 setting and childcare staff are certainly included in this new subgroup.
One of the things that we heard from both Governor Cooper and Secretary Cohen weeks ago was that as we made that move into Group 3, the state would not be doing that until they felt like they were in a position to have enough folks vaccinated to make that move. Now, there's still a couple of weeks before that period of time comes, but I think it's also worth noting that you've got a number on your website that shows how many folks are still eligible within the current groups here in Watauga County, and that number is still awfully high. So I guess the assumption here is that while one priority group may be coming on, you're still going to be working within those first, groups 1 and 2. So how do you work the balancing of that? And what have you and your team and the other vaccine providers talked about thus far as to how you'll be able to maintain both of those operations?
Well, I think we're still figuring it out. So, we don't typically get a lot of notice when these types of announcements are made anyway. And we have 8,400 people on our list as of Monday this week. So it's quite a long journey to get to the next group. But I think that what we've heard from the governor is that this is important. And so we are going to work with our other vaccinating providers, Appalachian Regional Healthcare System and High Country Community Health, to have some conversations about the best way for us to continue to prioritize 65 and older population just due to their risk of severe illness and death. And then also consider how do we work in this group that's also important to us.
Dr. Elliott, I know you've mentioned on a few occasions that you have educators and staff members that have signed up and have been eager and have communicated that eagerness to get vaccinated within your staff. Can you tell us how this messaging has played out with your group and where you are operationally working right now to get organized for this opportunity for staff members to begin receiving vaccine?
Yeah, thank you, David. It's good to see you. Yeah, we have about 700 employees in our school system from our, what I would consider mostly all frontline folks working in our schools, bus drivers, cafeteria staff, teachers assistants, and everyone across the board. Early in January, we put out a sign-up sheet for folks so that we could begin to collect information about our employees, the age groups, job classifications, extenuating health conditions, things like that, so that we could be ready whenever the time would come. We didn't quite anticipate that it would be this early. We were all a little bit surprised by the governor's announcement this week. But we're trying to do everything that we can to be prepared to help Jen and the hospital and all of our public health partners when they are ready for this group of employees to move forward. So, of course, we were excited to hear the governor talk about prioritizing teachers. We know that that teachers will be encouraged and feel reassured with that extra measure of safety and precautions. We know that we have many parents who are wanting their children to be back in school more days a week than we are currently operating, and that they too were glad to hear the news about prioritizing educators. But there's a reality here that the announcement did not come with any increase in the number of doses that are available to our community. So it does put our public health officials in a significantly difficult position to try to figure out what is the best way to take care of our entire community and to have the greatest positive benefit to the health of our community. So we know that on February the 23rd or 24th, when educators move into phase 3, we're not suddenly going to stop vaccinating other folks in our community, those age 65 and older, to stop and vaccinate the roughly 1,000 educators and childcare providers that are in our community. That we're going to, as a community, need to take a balanced approach to how we do this. We're also encouraged by our experience since the beginning of the school year with very little transmission, secondary transmission in our schools, with the success of a lot of the protective measures that we've put in place, most especially our contact tracing and investigations. As of today, our nurses have conducted over 2,000 individual contact investigations. And that the research that we've seen recently from the CDC and the Duke ABC Collaborative confirm that those children, especially those ages 10 and younger, are less likely to get the virus or to spread it to other children or to their teachers. So we're realistic about this news. We're encouraged by it. We're appreciative that educators have been prioritized, but we know it's not as simple as it might sound, and we know we still have a long ways to go.
You've talked a lot about the different challenges that you have within operating the entire school system here, especially as it comes to operations. And like you just said a moment ago, it's not just as simple. I'm sure that everybody involved with the school system would love to have students back in a greater number and in a more normal setting, but it's not sometimes just as simple as that from an operational standpoint. How can this vaccine deployment help solidify some of your operational concerns to make sure that the buildings themselves can even be open to take on students of any number that you're able to put in them?
Well, among the silver linings of this whole pandemic has been a greater appreciation for our teachers and of all of the things that school does for our children and for our communities. So keeping our schools open is a significant priority. And even though we've been operating in this modified schedule, it's been a measured approach to make sure that schools are open, but in a safe and healthy way. I mentioned earlier our very low rates of secondary transmission in school, yet there have been times when we have teetered on the edge of having to close schools because of a lack of adequate staffing. Bus drivers, cafeteria staff, and most especially classroom teachers and teachers' assistants. And that is largely because of the secondary transmission outside of schools between adults, including often with older adults, those age 65 and older, grandparents, aunts, and uncles. So as you've heard me say several times here, our community is an ecosystem and we have to keep everything in balance. But one of the reasons why I'm most encouraged about our staff having access to the vaccine is not necessarily to protect them in school, but to protect them outside of school, to keep themselves healthy, their families healthy, and so that they can continue to come to work so that we can continue to push to further increase schools.
Jenna, I know that we try within this channel and in the many times that we've talked to you over the course of time, one of the main things that we really are appreciative of your input on is helping manage expectations community-wide. And we have seen this vaccine process has been constantly evolving since it was first rolled out. There's not one element of it that looks the same as that initial shell version that came out back months ago. And certainly we're going to see more changes that are coming, whether that's additional priority groups or timing changes, that kind of thing. So with all of that said, if I were to ask you how the community could maybe keep expectations in check and be realistic with how this rolls out, I'm sure that probably comes with the caveat of you've still got questions that need to be answered. But what would your message maybe be to a community that is starved for, some good positive news on this front? What is your answer in terms of expectations at this time?
I think it's important that we remain hopeful and realize that, our goal is to make sure every person that wants a vaccine gets a vaccine as quickly as possible, and that we remain prepared along with our other partners who are vaccinating to try to scale up as supplies increase so that we can vaccinate more people. But it is important to know, on the day of February 24th, you're probably not going to be able to show up at one of our vaccine clinics and get an appointment. We are going to have to take a measured approach to try to balance the whole public health risk that we have in the community, and try to also make sure that we are hearing this directive from the state. That is certainly important, for us to think about childcare access and schools, both for our families and people working, and also just we know that we're still not out of this yet. So I think it's important to stay hopeful, but also have a real expectation that we're going to have more information to come. And I hope we can come back soon, David, and talk more about details.
Well, we look forward to pulling all of the vaccine providers together, hopefully next week on this channel to get a little bit more detail, as you mentioned, based on just being able to get some questions answered, I'm sure, here over the next couple of days of the week and over the weekend. One thing that I think people can do the math on based on what you all have said, you've got roughly 8,300 people that are still in group 1 and 2 that await vaccine. You've got about 1,000 people that could be added with this group 3 allocation for the educators that have been selected as part of this priority group to begin group 3. We also have about 500 doses of vaccine coming into the community each week. So the question there is, can you give us a little bit of insight on how you and the other providers are working to try to make the case for Watauga County about needs beyond just that weekly allocation, and maybe just a little bit about how that works? Because I know that's not as simple as just picking up the phone and saying, hey, send us some more. There are priorities that have to be worked within the state. So what can you share with us about what that looks like?
Well, we are certainly, the first thing we have to do is make sure that every week when we get first dose allocations, we receive those typically by Wednesday, and we have to put them in ARMS and have them documented in our state database by Monday following. And so that's the first way that we protect our allocations. The next way that we do it is by submitting for events. And so we're working together with several partners, along with Appalachian Regional Healthcare System and High Country Community Health, to try and submit for larger events where we could request an additional allocation of vaccines at community locations and be able to hopefully get to more of our population. And we still have yet to learn about whether that's been approved, but it is something that we are trying to do to add to our capacity.
Give both of you the opportunity to maybe closing thoughts. Dr. Elliott, we can start with you. I know that you've got a variety of constituents that you message to, your staff and certainly the teachers that have risen to the challenge and made school possible for us during these times. Not every district in the state is doing what Watauga County is doing. So I think that's you're to be commended for how you've led that. But you've also got parents and students that are eager to return to normal too. So your closing thoughts in this conversation about anything that you'd like to address with them specifically.
Well, thank you, David. And as always, I just want to reiterate again my appreciation to our community health partners and all that they are doing. And the school system has been very proud to be a partner with them with the vaccination of our community, including those events at our high school, and hope to continue to do that for the community. Also, just want to say again directly to our teachers how completely we appreciate them and how heroic I think that they have been throughout all of this, showing up and doing the work. And my thanks to my fellow parents out there for your patience, even during these very extremely frustrating and difficult times. And we are working towards moving towards a Plan A scenario for our K-5 students. Our Board of Education has set up a work session coming up on February the 22nd. Vaccination distribution is one of the things that they are considering as one of the many factors in thinking about how and when we reopen schools. And last, I would just say, again, we're part of a bigger picture here, and you just ran the numbers for us. I want our parents and our teachers to realize that we still have a long way to go, and to not have unreasonable expectations for what is or is not going to happen on February the 24th. And that I promise we will continue to work together with these partners to have a plan in place for how we make sure that the vaccines get to our educators as soon as those vaccines are available.
Excellent. Jen, same thing for you. Any closing thoughts that you might want to share with the community at large as we move into the weekend here, and knowing that we'll probably have some more details to share next week?
Yeah, I think the main thing to know is that we are working hard to create a plan that would, be prepared not only for our teachers and childcare staff, but also the broader Group 3 essential workers, and how that's going to, be part of our overall strategy to get the community vaccinated. So the biggest thing I would say is stay tuned. If anything is new in this, it's that, things continue to change and be updated. And I really appreciate you giving us an opportunity to keep the community informed, and really appreciate, as a parent, I want to say I appreciate all the work the school has done. I know that it's not been easy, but it has been incredibly helpful. And from a public health perspective, so many of the preventive measures that have been taken have been very helpful, and really, in my view, have proven to be very preventative. So I feel good about that, and I hope everyone will stay hopeful.
Well, thanks to you both for taking some time, and I'd close by saying, that we understand that there are a lot of people that aren't included in that priority list that do fall into Group 3, the essential frontline workers in a number of different scenarios, whether that's the food workers or folks at the university, other settings within our community that are eager to find out how that pacing works out for them. We will continue to work with our partners like Dr. Elliott and Jennifer Greene, as well as other folks within the areas that we are getting information from, to keep you updated on those timelines, changes, amendments to priorities. I think that the main thing that we can tell you to do is stay up to date. Make sure that you're keeping your staff informed with the best information, not Facebook information, but the best information from resources, to make sure that we're spreading the right info about timelines, groupings, and things like that, so we can manage those expectations. It's not working at the pace that maybe we would all like it to, but what has in the last year, right? So we're all just going to continue to go at it together and work as hard as we can to make sure that we keep Boone as healthy as we possibly can. Thanks to both of you for your work in that, and we look forward to talking to you again soon.
Thanks, David.